All right, it is about noon, so we will begin. Welcome to today's webinar, Preparing the Next Generation of One Health Practitioners to Combat Climate Change. This webinar is brought to you by the Canadian Public Health Association through the Infectious Disease and Climate Change Project. Thank you for joining us today for our third webinar in our fall series, where we will explore current and emerging infectious disease and climate change topics to share knowledge, research, and best practices. My name is Maddie Schuler, Project Officer with CPHA, and I will be the moderator for today's webinar. Before we begin, we want to acknowledge that the Canadian Public Health Association's office is situated on the ancestral and unceded territory of the Algonquin Anishinaabe people. And I am currently tuning in from the traditional homeland of the Anishinaabe, Haudenosaunee, and the Huron-Wendat. They have been the guardians of this land for a millennia, and we are grateful for the example their stewardship provides. CPHA is committed to working with all First Nations, Inuit, and Métis peoples and their governments in realizing meaningful truth and reconciliation. I wanted to take a quick minute to show you all the winning posters from CPHA's Infectious Disease and Climate Change Grade 6 poster contest. This was an opportunity for teachers and students to learn more about climate change and the impact it is having on the spread of infectious diseases like Lyme disease and West Nile virus in our communities. Students across Canada could submit a hand-drawn poster to bring attention to a climate-sensitive infectious disease for a chance to win a Chromebook and other great prizes. You can see all 8 winning posters at cpha.ca/contest. And we are actually looking at running this contest again in early 2023, so stay tuned. Just a few quick notes before we begin. If you have any questions for our presenters today or technical difficulties, please type them into the Q&A box at the bottom of your screen. After the presentation, I will read out the questions and our presenters will answer them. We strongly encourage attendee participation and look forward to hearing your thoughts and questions today. Secondly, our webinar is being recorded and will be made available on CPHA's YouTube channel a few days after the end of this presentation, and presentation slides will also be shared. Lastly, we love to get your feedback, so after the webinar, please fill out our 5-minute survey, which will open automatically in your browser once you close Zoom. Now, I would like to introduce our speakers for today's webinar. Dr. Jane Parmley is an associate professor in the Department of Population Medicine at the University of Guelph. Her research interests include antimicrobial resistance, animal health surveillance, and the interconnections between human, domestic animal, wildlife, and ecosystem health. Dr. Katie Clow is an assistant professor in One Health in the Department of Population Medicine at the Ontario Veterinary College, University of Guelph. Her research focuses on the ecology and epidemiology of vector-borne and zoonotic diseases. She also conducts research more broadly on One Health, including pedagogy and community-level applications. Carrie McMullen is a PhD candidate at the University of Guelph in population medicine and the collaborative specialization in One Health. She was raised on a cash crop farm in southwestern Ontario, which budded into a lifelong love of learning and contributing to research in agriculture and One Health. Radhika Gandhi is an MSc student from the University of Guelph, working towards her degree in epidemiology and a collaborative specialization in One Health. Radhika graduated with a Bachelor of Science in Biology from the University of Western Ontario, where she participated in a study that assessed the impact of collaborative course designs between faculty and students on student growth and awareness. Radhika is currently working alongside Drs. Katie Clow and Jane Parmley to identify innovative pedagogical styles that can be used to address complex transdisciplinary problems with a One Health approach. She hopes to apply her findings to strengthen One Health and climate change education. Radhika also strives to improve STEM teaching and learning approaches with the goal of making the field more accessible, inclusive, and equitable for diverse learners. And with that, I would like to turn it over to our presenters.
Great, thank you, Maddie. All right. Thank you everyone for joining us for our webinar today. As Maddie mentioned, preparing for the next generation of One Health practitioners to combat climate change. Kind of a large undertaking, and we'll share with you how we've made progress on this research. So I am joined today, as Maddie introduced, with Dr. Jane Parmley and 2 of our fabulous graduate students working on this project. Next slide, please. Oh, before we go on, sorry, Jane, you can go back. So we will be using Mentimeter, and so the code is at the top. And so if you just want to jot down that code and go to menti.com, when we get to the question aspect of our presentation, you'll be able to participate in the webinar at that point. Great. So as you know, I'm sure everyone is familiar that climate change is a very complex, messy problem. It has had and will continue to have far-reaching, predictable and unpredictable impacts on the health of humans, animals, and our ecosystems. With this big, messy problem, we need a workforce that is set to tackle this big issue. And really, in conversations with colleagues and in the literature, we know that the One Health approach gives us a really strong approach to go forward in complex problems. And so we think that we really need a strong workforce of One Health practitioners that are enabled to combat the climate crisis. Next slide, please. So if you aren't familiar, which One Health is becoming more and more sort of common in our conversations, I wanted to share this definition of One Health from the high-level expert panel. There's been definitions of One Health for decades, but we chose to share this one because it's quite comprehensive, and we really think it highlights what we're striving for when we're thinking about One Health education. So One Health is an integrated and unifying approach that aims to sustainably balance and optimize the health of people, animals, and ecosystems. It recognizes the health of humans, domestic and wild animals, plants, and the wider environment, including ecosystems, are closely linked and interdependent. The approach mobilizes multiple sectors, disciplines, and communities at varying levels of society to work together to foster well-being and tackle threats to health and ecosystems while addressing the collective need for healthy food, water, energy, and air, taking action on climate change and contributing to sustainable development. So that's a pretty big task, but something that we really need to move forward towards in our complex world. Next slide. So if we're thinking about One Health and One Health practitioners, how do we develop these individuals? If we think about past structures, generally in our education, a lot of things are very disciplinary specific, where you choose the discipline that you're studying in and you become an expert in that discipline. And certainly in all areas, disciplinary expertise is very important. When we're thinking about One Health practitioners, it's that ability to work across disciplines and understand other perspectives that really is of value and gives a strong skill set to work on some of these complex issues. So when we're thinking about developing One Health practitioners, we've looked at the pedagogical literature, and core competencies are something that's widely used in professional education. Core competencies are required knowledge, skills, and attributes that have been decided upon by the profession that these are what graduates need to be able to succeed. And certainly the Canadian public health education has core competencies, veterinary medicine, medical education, so that they're very common and provide rigor in educational approaches. At the University of Guelph, we have several One Health programs that have recently been developed and have been launched and are in the process of being delivered and will be evaluated. This includes a graduate level program called the Collaborative Specialization in One Health, which is sort of an add-on to a primary program of interest that allows students to develop a skill set in One Health while conducting research using the One Health approach. Fall 2022 marked the first cohort of the Bachelor of One Health program. And we also have One Health education being integrated into our DVM program, or our Doctor of Veterinary Medicine program, throughout the 4 phases. Next slide. So as we set out, Dr. Parmley and I, and a group of other faculty, of course, to develop some of these programs for higher education, we sat back and thought about, well, what are the core competencies that we need to incorporate into these programs? And this began with a review of the literature, which was assisted by a really strong contingent of summer students and allowed us to put together an initial set of competencies. We then brought together educators involved in One Health across the country to really look at these initial set of competencies, discuss them, refine them, and we ended up with a new refined list of competencies. Next slide. And so that brings us to where our project sort of starts. So on this slide, you can see our draft framework for One Health core competencies that was developed after that consultation with educators. And the big boxes at the top kind of highlight the three main areas we're thinking about. So the what, healthy animals, people, ecosystems, the how, building interconnections and working together. And then the why are we doing this? Doing better and making positive change. And underneath those, there's a list of core competencies that really are needed to achieve these big sort of buckets of ideas. But as we started, this is kind of where we start our research project. So we have this idea, it's been refined through literature and conversations, but still needs more community level input. Next slide. And so at that point, we decided to tackle this next research project, evaluating One Health competencies our current and future One Health professionals prepared for climate change. And on this slide, you can see the 5 objectives of this multi-year research project. The first being really identifying those core competencies, particularly those required for leaders in climate change and mitigation and adaptation, looking at appropriate methodologies to then, deliver these core competencies, build these core competencies and assess these learning outcomes. And then it moves on to develop a draft evaluation framework that can be used across Canada for One Health higher education programs to really develop that rigor in training. Next slide. And so today for our discussion, we're really going to focus on the first 3 objectives because they lay the foundation to then move on to objective 4 and 5 in the future. Next slide. Our methods for this research project focus predominantly on 2 areas. The first being stakeholder consultation, which is necessary for core competency refinement and determining appropriate teaching strategies that will foster the development of these core competencies. And then knowledge synthesis work, again, for teaching strategy development and moving on to developing that evaluation framework. Next slide. So I'm now going to hand it over to Carrie McMullen, our fabulous PhD student who's been working on part of the stakeholder consultations for this project.
Hi, everyone. It's so great to be here today sharing our project with you. And I'll talk about our first stakeholder consultations where we actually went out and talked with these people working in climate change using a focus group methodology. Next slide, please. So to first talk about our participant eligibility and recruitment, I first identified different climate change, environmental, or sustainability organizations within Canada using both the knowledge of my advisory committee members and then conducting an additional Google search to identify some further organizations. For a participant to be eligible from one of those organizations that I identified, they had to have a significant climate change component in their job description or title. And they also had to have publicly available contact information to be part of the recruitment and consent process. And then for recruitment, I grouped all of these participants based on their province of employment to cover these 5 arbitrary areas across Canada that we identified to run our focus groups within. And then email recruitment ran until enough were enrolled and consented to be part of these sessions per focus group location. And because of COVID-19 at the time, all of these sessions were run using Microsoft Teams. Next slide, please. So we ended up conducting 4 focus groups with participants working in climate change across Canada. And these sessions lasted about 2 hours each with about 8 questions for the participants. And this map just shows the breakdown of where the participants were located. So we had 7 participants in our Western province session, which had representatives from all 4 provinces to the west of Ontario. 4 participants in the Ontario session, 3 in the Quebec session, which was run all in French, and then 7 in the Western province session with representation of all of our Atlantic provinces as well. And you can currently see that there's a question mark for our Northern Territory session. And this is just because I needed special licensing approval to even speak with or recruit participants living in Nunavut and Northwest Territories. So we're working on gaining those licensing approvals. We just had the Nunavut one come in a couple weeks ago, actually, but we're waiting on the Northwest Territories license. And then we can move forward with gathering those very important perspectives from Canada's north. Next slide. So part of these focus groups centered around presenting this draft One Health competency framework that Katie talked about in the beginning to the participants and asking them where they see climate change fitting into this framework, or what needs to be added or removed to make it more relevant to their climate change roles and responsibilities. Next slide, please. Next slide. So to share some results with you, these are the 10 major competency theme areas that participants came up with when I distilled information from all 4 of the focus groups. So these competency themes also came up before participants even saw our draft competency framework. So these are more or less their unbiased perspectives of important competency domains in their areas of work. And they also didn't group the competency themes based on how you're seeing them on your slide, but I just thought it made a little bit more meaning from what the participants were saying. So if we first look under the knowledge domain, participants discussed the importance of being a lifelong learner and adaptable, understanding policy, governance, and civics considerations, both within climate change policy as a whole, but also for those like within organization governance structures that students aren't really exposed to in university. And then although scientific literacy was a smaller part of our discussion in these focus groups, so participants emphasize more of those soft skills or non-technical skills, they still brought up the importance of these students having that basic climate knowledge or basic scientific literacy considerations that we have in our Bachelor of Science degrees. If we move to the team, collaboration was by far the most discussed competency in all of the focus groups. And then they also acknowledged that these social science considerations of equity or having humility in how we go about our work or work as a team are really important in their climate change roles. Under the doing, the theme of action was heavily emphasized as our participants find that recent grads that are hired within their organizations often get caught up on finding more information sources or better information sources, or building these better models to lead them to the answer of how we can actually act. But all of this distracts from actually doing something about climate change. And we know that we needed action yesterday. So they really want these students to have this action-oriented lens. And then, of course, evaluation was emphasized to understand what's working well, what's not working so great, and then changing our action or solutions based on those evaluation findings. And then under the bettering domain, communication was the second most discussed competency, which I don't think is a surprise. And then participants also acknowledged the importance of resiliency. And they brought up that this means resiliency for the communities or populations experiencing climate change, but also for students or people working in climate change to have this aspect of personal resiliency, because they deal with so much doom and gloom on a daily basis when working in climate change world. And then, of course, professionalism and skills that fall within that underpinned each of these domains. Next slide, please. So this little pie chart just shows the number of times I coded different items to these overarching themes that I shared. So you can see that collaboration was the most coded in these 4 focus groups. Communication followed, and then all the other themes are roughly equal, except for resiliency being the smaller number of items or times that I use that code, but doesn't mean that it's any less important. Next slide. So I know this slide is a bit blurry and busy, but I just wanted to share the breadth and kind of beauty of the comments we received when we actually did share that draft One Health competency framework with participants. And I'll just draw your eye to the bottom corner there where I have this legend of the blue stickies on the screen are from the Quebec session, the yellow stickies are from the Western session, and so on. So we do have some sticky notes that are overlapping between the groups. So there was a lot of items that came up that participants were agreeing upon between the focus groups. But there's also a lot of items where participants differed in opinions or what they spent a lot of time in these sessions talking about. So when I actually distilled these comments, I want to show you what it means for our competency framework. Next slide. So under the first domain of healthy animals, people, and ecosystems, the participants didn't have anything to add in terms of competency. They just had a lot of comments about additional context between some of these enabling competencies you can see in gray for what that means in terms of their roles and responsibilities. Next slide. Under our second competency domain of interconnections and working together, this is where the participants felt that that evaluation piece could come into our problem solving and critical skills competency. So they're discussing that students need to understand economic impacts and how to conduct costing, conducting those outcome and process evaluations, conduct risk assessments, and be able to point out different points within our systems where we could actually manage those risks. Next slide, please. Under our final domain of doing better and making positive change, this is where participants saw a couple different changes could happen within our framework. So under professional and ethical behavior, this is where they felt that action piece could come in. So being committed to adaptive management, having these students that are able to act in that uncertainty or acting in that gray, as I talked about before. These students should be committed to servicing and be accountable to the communities that we're implementing this action within or working with to implement these solutions. And then also be creative in the solutions that we're coming up with, because we know the status quo isn't working in our climate change mitigation or adaptation. And this is where they also saw that personal resilience coming in. So I should have highlighted it for you on the previous slide, but we do have resiliency in terms of those communities experiencing climate change or our populations affected by climate change under our healthy animals, people, and ecosystems competency theme. But we don't yet have this personal resiliency piece. So they felt that it could be added here, where these students need to be able to manage their stress and despair. And then why you're seeing this arrow from action as an enabling competency to action as one of our core competency themes is that participants just felt that action and this idea of actually doing better in our climate change work could be one of our core themes on its own. And then finally, they felt that our entire competency framework should maybe bring this sustainability lens, they called it. So sustainability could also be one of those core themes in our framework, where we could consider the sustainable development goals and the interconnections of sustainability with each of our One Health pillars, since this is such an important area in climate change work. And now I will pass it over to Radhika on the next slide.
Radhika, you're just on mute.
Oh, thank you. So Carrie did a great job presenting you with our framework, which included perspectives from climate change professionals. But what about students? We wanted to capture student perspectives on teaching and learning strategies used within the One Health course and/or One Health program. This was done by conducting focus groups with students from university, with university students. But before we talk about the focus groups, let's discuss a little bit about the theory behind curricular framework and teaching strategies. So on the next slide, you can see the backwards design model. So we're going to focus on the figure on the left. So it's called the backwards design model because you start backwards. Step one, you identify your desired results. For example, if you have a course about climate change, your desired results may include having students identify long and short-term factors impacting climate change. For step two, we determine acceptable evidence to see if students have met your desired results. Sticking with the same example, acceptable evidence can include a presentation and generation of an independent systems map. And finally, in step three, we identify the appropriate learning experiences that will help accomplish step ones and step two. For our example, we can use collaborative and technology-based teaching and learning. So with the backwards design model, we start with the overarching learning outcome and work in a stepwise fashion to create our curriculum design. The big caveat here is that the stepwise approach is only really theoretical. In practice, this process is much more complicated. And that brings us to the design on the right, which is a more modern version of the stepwise model presented with more commonly used terms. So as you can see, there are a few numbers on the image on the right, 1, 2, and 3. For number 1, it shows that intended learning outcomes actually corresponds to step 1 of the stepwise model. And number 2, feedback and assessment strategies corresponds to determining acceptable evidence. And step 3, which is teaching and learning strategies, corresponds to planning appropriate learning experiences for students. This version of the backwards design model is presented in a cyclical manner with bidirectional arrows, which highlights the process of curricular design is iterative and can really start at any point, as long as a final framework is presented in a logical manner where all 3 components are easily identifiable. Now that we've covered the theory behind curriculum design, let's narrow in on my focus with teaching and learning strategies. Next slide, please. So teaching and learning strategies can be broken down into 2 main subcategories. There's passive and active teaching and learning. Many people have been exposed to passive teaching and learning. This includes traditional lectures where instructors give a lesson and students listen and/or take notes. There's little room for interaction, time to ask questions, or flexibility in the lesson plan. Active teaching and learning, on the other hand, is an interactive strategy which requires students to think, discuss, and investigate as parts of their learning. A lot of evidence has actually shown that active teaching is more effective at helping students understand concepts than passive teaching. So underneath active teaching, I've listed out a few of the main subcategories. The first subcategory is action learning, which is rooted in small groups of colleagues addressing real-life complex problems, which is followed by action to address the problem. Next, we have experiential teaching and learning, which is learning by doing. And examples of this include conducting labs or doing community-based work. We also have collaborative learning, where students work in groups, and problem-based learning, which can be further broken down into subcategories, including case-based learning. The one thing I wanted to highlight here is that depending on how it's used, technology-based learning can be both active and passive. Watching a 2-hour documentary on rising sea levels is passive. However, completing an online interactive simulation on the same topic would be active learning. Okay, now that we've covered the basics about different strategies, let's move on to the focus groups with students. As previously mentioned, we ran focus groups with students to understand their perspectives on teaching and learning strategies presented in the One Health course or program. We had 3 main eligibility criteria for our focus groups. Number 1, participants must be current undergraduate or graduate students. Number 2, participants must have taken a One Health course. And number 3, participants must have been from the University of Guelph or the University of Western Ontario. So as previously mentioned, University of Guelph has a lot of different One Health chapters. Western University also has a One Health program for undergraduate and graduate students, so we decided to include them in our study too. The next slide shows our recruitment poster, which took place, this recruitment process took place online, and the poster was distributed to different One Health student groups and program officials who sent it along to students. The focus groups were scheduled for an hour and a half, and students were compensated for their time. So moving on to the focus group breakdown, we had 4 focus groups in total, 3 at Guelph, which were conducted in person, and 1 at Western, which was conducted virtually. Participants were grouped based on location in the program. If you click next, we have 2 focus groups dedicated to DVM students at Guelph. In total, 8 DVM students participated, and we had a mixture of year 1 and year 3 students. Next, our focus group, this shows that the UWO students participated in our focus groups too, and this was conducted online, and it included 5 undergraduate and graduate students. The participants had a variety of educational backgrounds, including medical sciences, gender studies, and English literature. And finally, we have our students enrolled in the collaborative specialization in One Health at Guelph. There were 6 participants in total, including both master's and PhD students. And again, similar to Western, participant backgrounds included population medicine, food science, and anthropology. For the focus group, we use climate change as the overarching theme, and each question posed in the session aimed at addressing one of the One Health core competencies presented to you earlier. So this now leads me to the next question. What are students saying about the teaching and learning strategies used in One Health courses and programs? The next few slides include quotations that I'll be discussing with you. So our first quotation comes from a student in the collaborative specialization of One Health. I'll read it out for you here. The chat function has really helped for students answering each other's questions too, because it's not always something that the instructor needs to actually say and bring up, but someone will say something in the chat and then other people from that actual discipline can chime in. It's the kind of sidebar conversation that don't necessarily interrupt class, but further add collaboration to the topic. The highlighted section here align with the core competencies of collaboration, communication, and problem solving, which is represented through technology-based learning via chat functions. So the next quotation is actually from a DVM Phase 3 student, and it reads as the following. We used Jamboard. We didn't love it. It was weird to work with. We've never heard of it before the module. I don't know, it was just confusing. Most of our time that we had allotted for the group work was just trying to figure out how to use it. Maybe something that's a little bit more user-friendly or something we know already, only just because it just made it weird. This quotation discusses difficulties in collaboration when using technology-based education. So it's quite interesting here to see the both sides of using technology in classrooms. So moving on to the next slide, we have a quote from an undergrad student at UWO. All of our projects were global, except I think one was Indigenous health. But other than that, my mind was on rabies in Bali. So being able to talk to people in Bali was a bit difficult given the very short time frame of our group project. But I definitely think when these projects happen again, considering more local issues would definitely be ideal. I think it's ideal to involve the local community stakeholders. This was coded as problem-based learning, and core competencies highlighted included collaboration and communication. Our next quote comes from a collaborative specialization student, and it reads as the following. The case study projects we did in our class really helped with introducing concepts of transdisciplinarity and complexity. We were introduced first with the fruits, the smoothie, and systems mapping, but I think really applying it through the case study was helpful for me to see how it was used in a real situation. We chose our own topic and see how transdisciplinarity and complexity actually occur in a real situation. Here, the student uses case-based learning to address real-life situations, which touches on problem-solving skills. Moving on to our final slide of quotes. And I'm not going to read these quotes out, but we have another collaborative specialization student. So with this quote, the competency here is holistic understanding of health, and the student is able to identify the different pillars of One Health and recognize the connections between them. They even recognize the in-between elements that don't necessarily fit into one pillar. And this was achieved through technology-based learning with the use of PowerPoint. And finally, onto our last quote from a DVM Phase 3 student. In this quote, the student talks about having a diverse career panel where professionals were open to answering different questions about their fields and career opportunities. It highlights professional and ethical competencies, and a career path isn't restricted to one type of teaching and learning strategy, so I just classified it as other here. So now that we've gone over some quotes, let's discuss a few takeaways. So if you click next a few times, so the first takeaway shows that a fine balance is needed with technology-based education. As previously seen, using the chat feature and using PowerPoint was beneficial, but when it came to using new, unknown software such as Jamboard, it hindered collaboration. So a good rule of thumb is to limit the number of new technology used. If it's a must to use new technology, suggest giving them a mini tutorial first so they aren't spending too much time on their own to figure out the interface. Moving on, students also shared that case-based learning helped them break down different components of a problem and understand how their knowledge can be applied to real situations. Next, according to students, panel style is a valuable strategy in building professional and ethical competencies. With panel style, they're able to have meaningful discussions in a professional setting and learn about different career opportunities. And finally, students also suggested more involvement with local community stakeholders. This can be achieved through community-based learning, which is a type of experiential teaching and learning strategy. So in the grand scheme of things, the focus groups gave us really great insight on what's working, what's not working, and areas of improvement with teaching and learning strategies in One Health courses and the program. And with this, I think I'm going to pass it back on to Carrie to discuss the next couple of slides.
Okay, yes, I'm back to talk about how we're going to put these pieces together and what this could all mean for a program evaluation framework. So as you've seen, we've developed these great One Health competencies. We've asked students what they want from our programs and how they think they learn best. And we've also talked with those climate change professionals about what they would want from graduates of our One Health programs. But how do we be sure that our One Health programs are actually delivering upon these competencies and delivering students what they want and delivering these different climate change components that I've talked about? And I might have more questions than answers as we go through this framework, but we still have a little bit of a process to show you. Next slide, please. So I've drafted this type of evaluation framework and tried to align that with this theory of change or logic model where we have these different outcomes from either the One Health program itself or different outcomes of points within our evaluation strategy that we can align to evaluation tools to actually see if the program is working the way we want it to. We're going to find space to then integrate those climate change focus groups, those student focus groups, along with a couple other research objectives Radhika and I are working on. And then we're going to validate this evaluation framework with university faculty and staff to make sure that it's actually useful in practice. Next slide, please. So if we first think about our short-term outcomes of our evaluation strategy, we would want to know that the One Health competency framework is complete. And that includes roping in those climate change perspectives that we've worked on gathering. And then we need to know that our programs, our One Health programs, are actually created using this framework. So you might be aware that there's other published One Health competency frameworks out there on the internet from the US or different Europe working groups. But we've done the work to make sure that this framework is relevant to a Canadian context and Canadian climate change mitigation adaptation goals. So our programs should be using the framework that we've developed. And then, of course, within our programs, student or course level learning outcomes need to be aligned to our program learning outcomes. And then hopefully we can assume that that means they're aligned to those competencies. Next, please. So in terms of what this could mean for different stages within our evaluation framework, we can look at stage 1, which would be One Health competency integration within our courses or within our programs to see that all of those competencies in our framework are listed at some point in these One Health programs. And a tool we can use to assess this would be curriculum mapping, for example. Next. In terms of stage 2 of our evaluation framework, we can look at the One Health inputs going into our courses or programs. So are the resources within our One Health programs conducive to our students actually learning those competencies? And one way we could assess this is by looking at the inclusion of non-academic experts in our course delivery. As you know, transdisciplinarity is centered to our One Health approach. So we need those non-faculty members brought into our classrooms as guest lecturers to help deliver some of this content. Next. If we look at some medium-term outcomes from our program or evaluation strategy, we need to know that these One Health courses are delivering upon those competencies in our framework. We need to look at those teaching and learning strategies that Radhika discussed, and then also different assessment methods we're using to make sure those are aligned to our course and program learning outcomes and aligned to those competencies. And then a longer term, medium term outcome would be that our One Health programs are delivering upon those competencies in our framework. And then we can assume that our grads possess those One Health competencies. Under the evaluation framework side, stage 3 could be looking at student performance and interest. Next, please. So some of our immediate outcomes, where an example of an evaluation tool under this stage could be analyzing the average grades of our students on a capstone project. And capstone meaning it's within one of our core required One Health courses, and then it's aligned to one or more of our competencies within that framework. Next. Stage 4 of evaluation could be looking at stakeholder perceptions and summative evaluation of our students. So an example here could be surveying grads of our programs after they've graduated, after they've left our institutions, to see what they thought about the program and if the program provided them with the skills in our competency framework. Did we deliver upon what we promised them within these programs? Next. And then in terms of these big picture, longest term outcomes, our program grads are able to contribute to climate change mitigation and adaptation. That's really this big picture goal that we have with this project. And then of course, that leads to Canada having an increased capacity to tackle these complex problems at the human-animal environment interface. Next. And stage 5 is a little bit blurry because these One Health programs are so new, but it could be looking at our program impacts or our ultimate outcomes. And evaluation tool examples here are kind of hard to conceptualize at this point. But we could, for example, survey our program grads, say 10 years after they've graduated, see where they're working, are they in the field of climate change, and see if they feel like they've been valuable contributors to the workforce as a One Health professional. So I'll pass it over to Jane for the next.
Awesome, thanks, Carrie. And so this brings us nearly to the end of our presentation. And I hope we've been able to give you an appreciation of what our team has been up to over the last couple of years, gathering perspectives from students, professionals, and soon some more perspectives from faculty and staff, scoping the literature and learning from other fields, and now putting that together into an evaluation framework. And ultimately, with that goal in mind that Carrie alluded to in terms of improving One Health education in Canada and really preparing Canada to deal with climate change going forward. But we still have some work ahead of us. We have those several scoping reviews that we still have to complete. We have some focus groups that we still have to conduct and analyze those transcripts. And we need to validate and then apply the new framework that Carrie just described to see how it works and if it can be used to improve our One Health programs, particularly at the University of Guelph, but ideally at other institutions across Canada. And I see all the components of this project that Katie and Carrie and Radhika have so nicely described, the scoping reviews and the engagement with different stakeholders, contributing to better development of One Health programs, and that those One Health programs that are able to identify and use updated and new and different teaching and learning strategies so that we can graduate competent One Health practitioners now and into the future. Ultimately, we hope that these innovative and effective solutions can be developed and applied to help mitigate and adapt to climate change crises that we're facing already today, and ideally to other complex health challenges as well. But we still have some barriers and challenges that we need to overcome, or at least sort of explore and address. And one of the first ones is, how do we make space for everyone in these new sort of One Health programs? Many of the competencies that have been highlighted by our participants and from the literature as well are behaviors of more extroverted personality types. But where and how can we ensure that there's space for everyone with diverse and unique approaches, behaviors, and skills in these challenges? Because we need all of those different perspectives. And I think we're having some discussions as a project team now, how to ensure that that's happening. One of the questions that we're constantly faced with is whether we're compromising depth for breadth in these new One Health training programs. Do graduates need some sort of disciplinary expertise, something to ground them as they begin their careers? And Katie alluded to some of the new training programs that we have at the University of Guelph, and we've been trying to deal with this. In the collaborative specialization, students have their disciplinary expertise, their home department, and then they have some additional program requirements to complete the collaborative specialization. And so we've tried to adjust for that in those programs, but this is an ongoing challenge for us. And again, the last one is whether the competencies that we've identified to date are useful in our fight against other complex challenges beyond climate change. Biodiversity loss, poverty, food security, you name it. Are these competencies not only helpful in resolving climate change or dealing with climate change, but can they be helpful in combating those other complex challenges too? And these are just some of the questions that we still have. And we have a few questions for you before we turn it over to you guys to ask us some questions. But before I get to that, I do really need to thank the Public Health Agency of Canada and specifically the Infectious Diseases and Climate Change Fund for supporting this project. And we wouldn't be where we are today without all of the time and willingness to share experiences from professionals, faculty, staff, and students, and their willingness to participate sometimes repeatedly, and to really share and be very frank and open about their perspectives and what they think is needed in this realm. So that brings us to the questions for you. And at the top of the screen, Katie mentioned it earlier, you can go to menti.com and then enter that code that you can see at the top of your screen. And I can't actually see the code, but can somebody just give me a thumbs up that they can see the code on the screen? Because it's hiding on mine.
I can see it.
Me too.
Perfect. Thanks. So we'll just give everybody a moment to do that, but I'm going to move to the first question while you're entering so that we can start to see them. And so the first question, sorry, is what should be the goal of our new One Health training programs? Are we looking to teach additional skills and knowledge on top of other disciplinary expertise? Or are we really hoping to provide different skills and knowledge completely separate from that disciplinary expertise? And I'll just pause here and see what people are having to say. See more people than that here, but I might move on to the next one just for the sake of time. Oh, they're still coming in. So it's about 50-50, additional versus different so far. I'm going to move us along to the next one. What do you think the critical skills and knowledges are for One Health practitioners? If you think about what people doing One Health should be able to do, what are they? And you can enter up to 3 different words into your phone or other device. So some of the similar things to what we've been hearing before. Seems to be staying stable. So I'll move on to our next question. Oh, I'll give it a moment. Cool. There's just 2 more. If you think about your workplace, what do you hope that new One Health graduates could bring to that workplace? They're not easy questions. I apologize. We're just really curious. Lots of good ideas there. That's awesome. And I like the mix from sort of strong analytical pieces like data analysis to new ideas, energy, decolonization. There's a whole realm of things there. That's great. Thank you. And the last one is maybe a bit leading, but is this who we should be training? Should our new One Health training program really be preparing students to be change leaders? Is that what we're aiming for? I'll take that as a yes. Awesome, thank you. With that, those questions were really fast and we provided a ton of information. But with that, I'd be happy for us to open it up for questions and maybe everyone can turn on their their cameras and their microphones. And Maddie, should I stop sharing?
Sure, yeah, you can stop sharing.
Okay.
Thank you so much for your interactive presentation. At this point, if anyone has any questions, please submit them using the Q&A feature. And I think we do have some that have come through already. So first question, what activities or opportunities would you like to see or encourage secondary school teachers to embrace in order to help prepare their students for programs like this and others that require an interdisciplinary approach?
That's a great question, Shauna. I think that's one of the questions or challenges that we still have is how to connect some of our higher programs to primary and secondary school activities as well. But I do think, and we've had some conversations, and I'll let the others jump in as well, but it's also about supporting students to ask questions, to try new things, to be open to, I don't like the word, but open to failure and learning from experiences that don't work. And I'm not sure how to build that into secondary school programming, but I do think it's something that we should have some maybe more conversations about between who are teaching early university level courses and those teachers that are in high schools teaching sort of late high school courses. And maybe we can have better synergy across the board there. Does anyone, Radhika, Carrie, or Katie, anything to add?
Yeah, I was just going to pipe in that I would imagine that secondary schools have a similar challenge in university, probably that much more so, in that it is very siloed by subject, and the opportunities to be able to look at complex issues from a variety of lenses is that much more challenging. And unfortunately, I don't know the curricular system that well, but and Radhika might be able to comment on some of the teaching strategies, but certainly things that we find are useful, like case studies or experiential learning, where you can kind of break out and provide the opportunity for students not to just apply one lens at a time, seem to be good at sort of encouraging that. And I think that's probably needed to drum up interest in One Health and those types of programs going forward, because I think students still think about university in quite a siloed manner too, right? Like, what is the profession that I'm going to go into and what subjects am I going to study? And I think we need a little bit of a culture shift to expand those opportunities, right? Because a lot of us aren't necessarily just working in one discipline anymore, because our skill sets need to be broader.
Great. Yeah, thank you. Building off of that question from Shauna as well, how can current public health practitioners embrace the One Health approach within their work at the local and regional level and help foster this throughout their organization?
That's the question of the hour.
But I think, go for it, Katie.
Just sort of off the top of my head, I think any opportunities to collaborate and bring in additional perspectives is really where the strength of One Health comes from. And certainly in public health, you're dealing with issues on a complex community level where there are so many different perspectives to bring in. The challenge with things like that is that ultimately they take more time and energy, right? It's easier for us to go along in our day just with our professional training without really engaging that broader level. And certainly when public health is under tremendous pressure with the pandemic and all of these challenges, bringing in additional perspectives and expertise is then taking away from all of that precious time to go towards that. But I think that's where the strength comes in, and whether, models for building in community engagement, whether there's, subcommittees to kind of bring that in, even on a small basis initially, really, I think helps initiate a One Health approach. Sorry, that was very general. I don't have really specific examples, but.
No, that's great. And was there any discussion about the competencies required for engaging with Indigenous knowledges and how to foster such competencies?
I can jump in for this one. Absolutely. We did talk a lot about Indigenous knowledge, and I wish I could have delved into those themes with you a bit more, but a lot of my coding or time spent analyzing the discussions in our collaboration theme was about that transdisciplinarity and bringing those Indigenous perspectives in, because they have a lot of knowledge and action-oriented type solutions that we certainly need to integrate into our perspectives and can just make our action and our mitigation adaptation strategies that much more full. And then this is also why we're prioritizing those Northern perspectives so much, because integrating those Indigenous perspectives that are feeling such the sensational side of climate change in Canada's North are really important to this project as well. So working on those perspectives.
Thank you, Carrie. Since it is 1 o'clock, I will end with one last question. And again, if anyone has additional questions for our speakers, you can email me and I will get you in contact with them. But as for our last question, we have an attendee asking, One Health is an amazing but pretty new concept for a lot of workplaces. How can we improve integration of One Health and promote hiring One Health professionals?
These are all good questions, and I wish we had better answers.
Or more time for really in-depth discussions.
Maybe that. I think it goes back to what Katie was saying earlier too, about finding time and thinking creatively about who we hire and who we bring in. I think oftentimes when you see postings for different jobs in government, academia, or industry, they're looking for a statistician, an epidemiologist, an engineer, public health nurse, something that sort of has a disciplinary ring to it. And yet when we talked with some of the climate change professionals in Carrie's focus groups, a lot of the skills they were looking at are these cross-cutting skills about how we can post positions or describe positions that have that disciplinary depth, but these other sort of skill sets as well. And that may not quite answer the question, but I think it's about thinking creatively about the jobs that we're looking to fill, the roles that we want those individuals to fill, and maybe not getting as stuck on the specific degrees or the specific credentials, but maybe more on the educational or the experiential component as well. And that's not easy, right? That takes a lot more time. And one of the big challenges with One Health generally is that it requires a little bit more time to have those conversations, to engage in that discussion. And most of us are working in roles where time is critically short. And maybe it's rethinking some of that organizational structure as well. Katie, do you have something to add to that?
Sorry, I was reading other questions that were coming in as well. No, I agree with you, Jane. And we've kind of talked about that, about how do we, even when we're thinking about assessment for One Health practitioners and our program, where are they going? Well, we're probably not going to find jobs that are like, we're looking for a One Health practitioner. And so looking at the diversity of where they're going and the types of skill sets they're using. So it's going to be a little bit more of a challenging evaluation for us as well.
Yeah. Thank you. Thank you all so much. Unfortunately, there's no more time for questions, but like I said, I will. I do have a copy of all the questions and can send them to our speakers and get anyone in contact who wants to discuss more. But again, thank you so much for everyone joining us, and thank you to our presenters for sharing your time and expertise with us today. Just a reminder to please fill out the webinar evaluation once you close your screen. And thank you all and have a wonderful afternoon. Take care.
Thanks all.
Thank you.
Thank you.